All right, let's jump right in. Today we're looking at a pretty wild paradox, where the exact medications designed to heal us can rapidly turn into deadly toxicological emergencies. Welcome to this explainer. When you pop open a pill bottle, you expect a cure, right? But the chemical reality of what you're holding is so much more complex than that.
So what actually separates a life-saving cure from a lethal poison? Honestly, it's a tightrope walk, and it's happening in literally every hospital pharmacy across the globe. We usually think of toxins as, snake venom or harsh industrial chemicals, but some of the absolute most dangerous substances you could ever encounter are sitting quietly on a pharmacy shelf, perfectly engineered to alter human biology.
Well, it all comes down to this concept called the therapeutic index. This is that tiny, incredibly narrow gap between a drug doing its job and, causing a massive overdose. Drugs with a wide therapeutic index, they give us plenty of room for error. But today, we're focusing on the drugs with a devastatingly narrow therapeutic index. We're talking about medications where the difference between a cure and a total catastrophe is just a few milligrams.
Think of this explainer as our own personal toxicology ward round. We're going to hit 4 main areas today: the cellular assassins, slaying the invaders, blood thinners and super warfarins, and finally, the hidden hazards. Let's get to it.
All right, Section 1, the cellular assassins. Let's look at how drugs that target rapidly dividing cells can cause some serious collateral damage.
Take colchicine. It's derived from the autumn crocus plant, and it's a go-to for treating gout. But here's the kicker. It essentially acts as a mitosis freeze ray by halting microtubule formation. It binds to tubulin to do this, which is fantastic for that inflamed joint. But in an overdose, it stops cell division across your entire body. Patients usually first show severe GI symptoms that eerily mimic viral gastroenteritis. But a ticking clock has started. That GI distress leads to a profound drop in white blood cells, cardiovascular collapse, and eventually multi-system organ failure.
And then you have antineoplastics like methotrexate. These are absolute cellular assassins. They interrupt folate pathways to kill off cancer, which is great, but they carry a huge risk of severe toxicity to healthy marrow and mucosa. When the dose pushes too high, it doesn't just stop the cancer cells. It acts like a carpet bomb on all of your body's rapidly dividing cells. We're talking extreme gastrointestinal sloughing and devastating bone marrow suppression.
When you break down the different classes of these cancer-fighting medications, you start to see that their side effects are just as fierce as the diseases they treat. Look at anthracyclines, like doxorubicin. An overdose there can trigger irreversible congestive cardiomyopathy, and that carries a staggering 48% mortality rate. Meanwhile, the platinoids, like cisplatin, they're infamous for causing irreversible distal tubular necrosis in the kidneys, plus high-frequency hearing loss. The collateral damage is highly specific, but man, is it severe.
Moving on to Section 2, slaying the invaders. Let's look at the bizarre side effects of the chemical weapons we use to fight foreign pathogens.
It's genuinely wild to think that the exact chemical weapons we use to slay invaders, bacteria, fungi, viruses, can misfire this dramatically. Take isoniazid, a heavy hitter for tuberculosis. In overdose, it radically depletes vitamin B6 in the brain. The result? Refractory, life-threatening seizures and severe metabolic acidosis. Or look at another TB drug, ethambutol. It can cause optic neuritis. It literally strips away a patient's ability to distinguish red from green, and then starts taking away their peripheral vision. And amphotericin B, it's a heavy-duty antifungal, but it is so tough on the kidneys that 80% of patients experience some degree of renal damage and potassium wasting.
And we can't forget antimalarials like chloroquine and halofantrine. They definitely have a dark side. In toxic doses, they really mess with the heart's electrical rhythm. Specifically, they cause something called QTc prolongation. If you know your EKGs, you know that can instantly trigger a lethal twisting heart arrhythmia known as torsades de pointes, not to mention massive drops in blood pressure from vasodilation.
Okay, Section 3, blood thinners and super warfarins. Controlling coagulation is a brilliant medical trick, but the risks are intense.
There is a really dark irony here. Warfarin is your standard, run-of-the-mill, inexpensive prescription blood thinner, right? Well, chemists took that exact mechanism and supercharged it to create commercial rodenticides, like brotafacium. These super warfarins are engineered to bind to liver enzymes for weeks or even months, causing massive, unstoppable hemorrhage in rodents. But unfortunately, humans ingest them too, and the effects are exactly identical.
If someone ingests one of these super warfarins, you're in a literal race against the clock. They might look totally fine for the first 24 hours,
But as their body's vitamin K stores run out, their ability to clot blood completely vanishes. We're talking bleeding from anywhere, mucous membranes, the GI tract, the kidneys. To save them, doctors have to push massive, prolonged doses of vitamin K, sometimes for months, just trying to outlast the incredibly long half-life of that poison.
That brings us to our final stop, Section 4, the hidden hazards. Because it's not always just the active drug that's the problem.
Here's a crazy reality check for you. When you take a pill, you aren't just getting the active therapeutic drug. You're swallowing a whole cocktail of excipients. These are the supposedly inactive vehicles, the colors, the preservatives, holding it all together. But here's the secret. There's no formal FDA approval system exclusively for these additives. And if you take them in high quantities or over long therapies, they can accumulate and become highly toxic all on their own.
Just look at propylene glycol. We use it to dissolve IV drugs, but in massive doses, it acts like an alcohol, causing central nervous system depression, cardiac arrhythmias, and dangerous hyperosmolality in the blood. Then you've got polyethylene glycol, which is used in bowel preps. Its osmotic properties pull so much water into the gut that it can cause severe internal fluid shifts. And historically, we've had to be super careful monitoring preservatives like thimerosal, which actually contains organic mercury, just to ensure exposures stay below toxic thresholds. So yeah, those inactive ingredients, far from harmless.
So, if the cure is sitting right in our medicine cabinets are so inherently dangerous, how do we actually fight back when things go south? This is where the brilliant science of antidotes comes in. Modern toxicology has built some incredible countermeasures. Remember those unstopping seizures from the TB drug isoniazid? We literally flush the patient's brain with massive, gram-level doses of pyridoxine, that's vitamin B6, to instantly replenish exactly what the drug destroyed. For a methotrexate overdose, we pump the patient full of sodium bicarbonate. That alkalinizes their urine and stops the drug from crystallizing and shredding their kidneys. And for a lot of overdoses, like with colchicine, we use activated charcoal to bind the drug right in the gut, completely interrupting its deadly recirculation.
It all goes back to that old saying, the dose makes the poison. Next time you open your medicine cabinet, will you look at those simple pills a little differently, knowing the lethal power hiding just a few milligrams away? From cancer-killing cellular assassins to blood-thinning super warfarins, the science of healing and the science of poisoning are really the exact same thing, separated only by the dose. Thanks for hanging out with me on this explainer. Keep asking questions and keep exploring the fascinating structures of the world around us.